Welcome to the joy of outpatient medicine. Let's get right to it. You have a high potassium in front of you. This is what we do. All right, here's my high potassium protocol, derived from UpToDate's algorithm used for outpatient medicine. If the patient has muscle weakness, cardiac dysrhythmia, or potassium greater than 6.5, send them to the ER ASAP for the recheck and treatment if needed. Number 2, if greater than 5.5 with significant renal impairment or acute ongoing renal injury, to the ER also to check the trend ASAP, including hemodialysis patients between dialysis if higher than their normal potassium. Number 3, if renal impairment and less than 5.5, repeat the lab in the office and check the meds as a common culprit. NSAIDs can cause hyperkalemia. ACE inhibitors, ARBs, spironolactone can cause hyperkalemia. Number 4, check the sodium. If the sodium is low with the high potassium, suspect ACE inhibitors, ARBs, or adrenal insufficiency. Consider endo referral after the repeat if not medication related. For chronic kidney disease patients, try to lower mild elevations with dietary restrictions, NSAID avoidance. Consider thiazides rather than ACE inhibitors and ARBs for BP control if chronically elevated potassium. Ensure you have a nephrology follow-up for these patients. Quick discussion: when potassium is elevated, you have a decision to make whether to repeat urgently in the ER versus the slower repeat in the lab. That's your primary decision. Next, make a decision on possible medication influences on the potassium as the primary etiology, and consider the need for consultants, nephrology versus endocrinology, for etiology and chronic management. This protocol is all I use for high potassium. I feel that I take care of the patient comprehensively and I get the patient to the consultants as necessary. For a deeper understanding of potassium elevation, when you have time, check UpToDate, read the entire article, the entire chapter, and become comfortable with the pathophysiology of this process. For now, though, you have this situation in the palm of your hand. Feel the freedom of that competency and efficiency, and that is how you will find the joy in outpatient medicine. Talk to you soon.